A selective dorsal rhizotomy is an operation performed to treat spasticity. It is thought that high tone and spasticity arise from abnormal signals that are transmitted through sensory or dorsal nerve roots to the spinal cord. In a selective dorsal rhizotomy, we identify and cut portions of the dorsal nerve roots that carry abnormal signals, thereby disrupting the mechanisms that lead to spasticity. Potential patients go through a rigorous assessment that includes an in-depth gait and motion analysis, as well as a physical therapy evaluation. They are evaluated by a multidisciplinary team that includes a pediatric rehabilitation doctor, a neurosurgeon, and an orthopedist. Appropriate patient selection is vital. Ideal candidates for selective dorsal rhizotomy are children who are between 4 and 10 years of age, have a history of being born prematurely, and have a diagnosis of diplegic cerebral palsy. These patients usually walk independently or with the assistance of crutches or a walker. They typically function at a level 1, 2, or 3 in the Gross Motor Function Classification System, or GMFCS. A selective dorsal rhizotomy involves the coordinated efforts of the neurosurgery, physiatry, anesthesia, and nursing teams. The operation entails making an incision in the lower back that is approximately 6 to 8 inches long. We perform what we call a laminoplasty, in which we remove the back part of the spinal elements from the lumbar 1 or L1 to L5 levels. At the end of the procedure, the bone is put back on. We identify and open up the dural sac that contain the spinal fluid, spinal cord, and nerve roots. Once the dural sac is opened, we expose the lumbar and upper sacral nerve roots that transmit information to and from the muscles of the lower extremities. At each level, we isolate the dorsal nerve root, which in turn is separated into as many as 30 smaller thread-like rootlets.